patients, especially antibiotics is definitely not advisable, not to all. Also nowadays people, since Dr. Vaishali also mentioned this point that the pharmacists are more like doctors and they give away drugs very easily. So if I've seen that people even take steroids over the counter to relieve pain and because it always gives a better feeling after you take a steroid pill and gives away all the fever, gives away the pains. So there are people who take steroids for a long time, even if they have minor symptoms like body ache, joint pains. So we should be more judicious when it comes to use of drugs, especially when someone goes to a pharmacist and asks for drugs for their symptoms. The first response of a pharmacist should be, you must see a doctor and then undergo the treatment, whatever is needed. Also, a lot of over-the-counter drugs need to be banned. However, we have laws for that, but they're not implemented always, and that is a big drawback of the society. But I think that especially antibiotics and the use of antibiotics has been very unjudicious in the last few years, and we've seen resistance being developed to most of the antibiotics. The reason being that people are just prescribed with them for no reason. Even if they do not need antibiotics, they've been taking it, and the wrong medications have been prescribed. So I think we can stop this by letting people know that not all diseases are recovered with antibiotics. Secondly, not everything that the pharmacist may put forward needs to be taken, or the doses that need to be given in should always be titrated by a doctor or a healthcare worker, and nobody else. I think that is what it is. The definition of fever differs from individual to individual. Generally, people think that 98, 99 degrees Fahrenheit is also called fever. However, we say that unless the fever does not touch 100.4, that is the oral temperature that we ask the patients to take always, it is not the paracetamol that people keep popping should not be taken, because even paracetamol in higher doses can cause toxicity. It can have some impact on the liver, and it is not advisable to take it for any XYZ amount of body ache. Or in fact, people most of the times have this feeling that they have fever. However, they do not even care to check it through the thermometer, and they just assume that they feel that they have fever, and they keep taking paracetamol, which is wrong, because paracetamol too has a limited dose that needs to be given through 24 hours. If you exceed the dose of paracetamol, it can definitely impact the liver. And yes, paracetamol need not be taken if the fever is anything like 99 degrees Fahrenheit.